Do you know that with a series of exercises for older adults in a chair, the effects of aging on the body can be reduced? Some are designed to improve flexibility, others to give your muscles more strength, and others will help promote balance and joint mobility. And there is more to find out on improving the health of old adults. Hello and welcome to the channel. If you are new here, hit that subscribe button and turn on the notification to get updates whenever we drop a new video. Don't forget to smash that like button and comment in the section below if you have any contributions. For all these benefits, we have selected a series of 10 exercises for older adults in a chair. These are some strengthening exercises for adults that you can do without leaving home. Other exercises that we will not delve into here, but are just as important, you can learn about in our other videos on cognitive stimulation for adults. Don't miss them. How to exercise sitting in a chair. With an object as basic as an office chair, you can strengthen all your muscles without the need to spend money on gym equipment or sportswear. The exercises that we have named above will help you develop your strength and muscles and will allow you to work on your balance and coordination. That way, you can train your body and mind at the same time. Another point in favor of exercises to do in the office is that it is a type of training that carries a lower risk of injury compared to other exercises based on bars, weights, or discs. And it is that the idea is to use the weight of our body to train without the need for any equipment. It is what is known as calisthenics. It doesn't matter if you are used to physical exercise or if you are starting to consider it right now. An exercise routine in the office using a chair and your body weight is something that can be perfectly adapted to what you need. Also, people who are used to working out can go a step further and increase their strength level to keep progressing. Of course, to do it effectively, it is best to choose a rigid chair that has a large surface and an optimal base. If it is the conventional office on wheels, it is also possible to train with it. It will be enough to take it to a corner to find a firm ally on the wall and to be able to carry out the exercises comfortably. Tips for exercising with older adults. Before starting the routine, you must follow these tips so that the exercises for the elderly are performed in the best way without harming the body or causing damage. Health experts recommend that exercises for older adults should combine aerobic practice, strength training, balance, and flexibility. Consult with your specialist doctor. Before starting any physical exercise, the elderly should have a checkup with their doctor because in this way, the health professional will be able to give them the endorsement that will allow them to start physical activity. This is especially important in the case of having undergone hip or back surgery. According to experts, it is the professionals who must indicate the frequency, duration, manner, and intensity with which each older adult must perform their exercises, in addition to the fact that medical follow-up must be individualized. Before starting any training, it is important to check the person's vital signs and thus avoid high or low blood pressure. Get warm. Performing a warm-up before any exercise is essential at any age, but especially in older adults. A walk will be enough to prepare the muscles and not hurt yourself. Stretching exercises should be done after warming up and before strengthening exercises. Hydrate yourself. It is very important to be hydrated to avoid decompensation and other discomforts. Experts also recommend always having a bottle of water on hand and stopping as many times as necessary to hydrate. When we get older, it is normal to lose some mobility, which makes it more difficult to practice some sports or physical activities. Paradoxically, the best way to prevent this from happening is precisely by exercising and keeping your body active. In this sense, it is very interesting to know sitting exercises for older people so that they can strengthen their bodies by doing different activities while sitting. From here, we propose different alternatives, the seated and standing chair exercises for old adults. Get up from the chair. In the first exercise for older adults in a chair, the patient should sit in the middle of the chair forward with their feet apart. He will then lean back with his arms crossed over his chest, keeping his back and shoulders straight. Returning to the starting position, he should extend his arms parallel to the floor, stand up, and sit down again. Raise arms. Another exercise consists of putting the arms at the sides of the body and with the palms of the hands facing backward. Then, the patient should raise both arms forward, up to shoulder height. He will then proceed to lower his arms and repeat the movement. Shoulder flexion. The shoulder flexion exercise is one of the most recommended strengthening exercises for adults. In addition to the chair, low-weight weights or dumbbells will be used. Experts recommend a maximum weight of 1 kilogram. The patient will sit in the chair with their back straight against the back, then hold the dumbbells at their sides with their palms facing in. In the case of series, he will have to raise his arms forward, turn his palms up and lower them back down. Bicep work. For the bicep work exercise, you also need 1 kilo weight. The adult should sit in a chair without armrests, keep their back straight on the backrest, and align their feet with their shoulders. Afterward, he will hold the weights with his arms at his sides. Then he'll bring one arm up while bending the elbow, swing the weight toward his chest, and return to the starting position. On each repetition, he will alternate arms. Stretching. Stretching is a great option to release tension in the body, relax muscles, and prevent pain. The most common areas to do so are the neck, lower back, and upper back. These are simple stretches that will improve overall flexibility. Of course, it is important to make smooth movements, control the posture, and avoid painful stretches. Work glutes and abs. The butt suffers a lot from sitting for so long, and a simple trick can help to harden it. It consists of contracting the buttocks with a straight back while the person remains seated in the chair. As for the abdominals, the exercise is similar and is based on contracting the abdomen at the same time that we do it with the buttocks. It is important to keep the gut contracted for a few seconds to obtain optimal results. Tiptoe standing. While sitting, move the balls of your feet quickly to exercise your feet and legs. That way calories are burned and circulation improves. Reduce tension in the shoulders. It is possible to reduce the tension in the shoulders by raising them for a few seconds and then relaxing them. Of course, it is convenient to repeat this exercise as many times as possible throughout the day. Seated leg raises. The exercise consists of sitting up straight with your legs stretched out and your feet crossed. In this position, you have to raise your legs and bring them up to the hips several times. Another exercise is to raise and stretch your legs in the air simultaneously or alternately. This exercise is good for reducing the effect of tired legs and improving circulation. Leg adduction exercise. To do the leg adduction exercise, simply place an object on the inner side of the thighs and hold it tight between the legs to prevent it from falling to the ground. Your goal is to keep your adductors firm and tone your legs. Triceps work. It should be done while sitting on a chair near the edge. The patient will raise one arm toward the ceiling, then bend it to the elbow. With a steady forearm, he will stretch his arm out and slowly lower himself. Knee flexion. This exercise for older adults in a chair is aimed at strengthening the knee joints. The patient should stand and lean behind a chair. Then he will lift one leg without bending it back. Later, he will raise the heel back while he bends the leg and holds the position for 3 seconds. Hip flexion. The patient will stand up and hold the chair with one hand, then raise one knee towards the chest and hold the position and then lower it. He will do repetitions with both legs. Plantar flexion. The adult will stand behind a chair and lift the leg without taking the ball of the foot off the floor. Subsequently, he will slowly descend. Abdominal twists. In this exercise for older adults, a ball will be used. The patient should sit with the ball in the hand at stomach level and will turn the torso to the right and then return to the center, then do the same to the other side. Now you know that to have a healthy old age, exercises for older adults are basic since they will help strengthen and give flexibility. The physical and mental go hand in hand, so you should not neglect cognitive stimulation as it can prevent Alzheimer's symptoms. Thanks for watching, and we hope you learned something new about the importance of chair exercises.